evening. This week we're going to focus on chapter 6, which is health promotion in the individual. So we're looking at your patient as an individual. We're not looking at outside community or family aspects. This is just the individual. And the key concepts to health promotion uh, are accomplished through the nursing process. So even though we are about to become family nurse practitioners, we still follow the nursing process, which includes assessment, diagnoses, outcome criteria, process criteria, implementation, and evaluation. So those components are still key to our process of planning care for our patients. And we want health promotion assesses strengths, not only deficits. So we want to look at what the patient does well. It's tailored to the individual, and it is ever changing. So especially during life processes, as they change, go through different stages of their life, this is going to change. Framework for nursing assessment. We use the four core values of the American Holistic Association: philosophy, holistic nursing process, self-care, holistic communication. And one of the models associated with nursing assessment, well, there are different models. There are several different models. Health belief model, um, strength-based or assessment models, role modeling, resilience, and Marjorie Gordon's functional health patterns. So there are different health models out there that some providers will follow in their practice. Many areas address primary prevention for individuals, and this speaks to Healthy People 2030. I spoke of this before. The World Health Organization every 10 years comes out with a directive of what their health goals are for individuals for the next 10 years. And so this one is going to be coming up pretty soon. And part of Healthy People 2030 addresses primary prevention for individuals, um, and reduce the proportion of adults with osteoporosis, increase proportion of adolescents who receive preventative health care, reduce the proportion of adults living in poverty. And these are really big goals. Osteoporosis, we have many um, medical interventions right now that can help reduce the risk of osteoporosis in adults, especially women. And so we can do that. And adolescents receiving preventative health care. It's amazing to me when I see how many children have not received the HPV vaccine at age 9, which is where it is indicated, 9 to 11. If you get it at 9, you only need 2 shots. If you get it later, you're going to need 3. So the earlier, the better. And reduce the proportion of adults living in poverty is a very big goal. Poverty is vast and ever present. But one of the Healthy People initiatives is to reduce that. Assessment of the individual, health promotion, key. Um, as I stated earlier, I do health promotion on every visit, and I do acute care. So the patients are coming in for an acute illness. But I look through their chart and I see if they're up to date with their immunizations, if they have had their mammograms, if they're up to date with their pap smears, colonoscopies, etc. And I ask them that, remind them. Um, Health promotion focuses on nursing knowledge, provides structure, holism, um, and characteristics, focus of patterns, examine patterns over time. Blood pressure, again, like I advise my patients, I always look at their vital signs. Now, I do have some patients that come specifically to see me, but I do not do primary care. So if a patient comes in, I have to look at their history. And gratefully, since many organizations use Epic, I have the ability to see patterns in blood pressures. So, for example, the other day I had a patient who came in with a relatively high blood pressure, but normally it's normal. And I advised him, I said, your blood pressure is a little high today. However, hypertension is not diagnosed with one isolated elevated blood pressure, and you have a history of very normal blood pressures. So I would keep an eye on it, take it in a week or two when you're feeling better, and let's see how it is. If it remains high, follow up with your PCP. Environmental influences on pattern, age developmental issues, and functional individual performance of tasks, cultural influences, health patterns. I'm a real big believer in Erickson stages. Not everybody follows these types of standards, but throughout my years, throughout my life, I've just seen it makes sense to me, these stages that Erickson has set out. And so it may be something that you want to consider as well. In fact, I guess when I went to NP school, much of our training was focused on Erickson's. That's probably why I feel that way. All right, we're going to look at the patient's health patterns um, and behaviors, role of the environment, developmental influence, assessment, strengths and weaknesses, dysfunctional and actual, potentially dysfunctional or at risk. The nurses determine the cause and plan remedial action. Health promotion is overarching goal. Problem in one area is occluded dysfunction in other patterns, which is definitely true. But remember, what we talked about a few weeks ago is motivational interviewing. And if the patient is not ready for change, and I don't care what model you aspire to, but if the patient is not ready for change, it isn't going to happen. And all it is going to do is frustrate the patient and frustrate the provider. So you have to identify when the patient is ready for change, and then we can step in and begin the implementation phase. All right, nursing interventions and outcomes, pattern focus. We spoke of these, age developmental focus, and functional focused. Culturally competent care. We always need to consider that. I remember, I don't know if I've said this before, but back in the day, I was a labor and delivery nurse. That's how I first started out my career, and I learned so much because even though I was in the northwest suburbs, my hospital was quite culturally varied, I guess you'd say. So I had a lot of different exposure to culture, and I was very interested in it. So I would always ask my patients respectfully um, about their cultures, and they always would share. Sometimes, their Asians don't want to drink anything cold after the baby comes, only warm things, all sorts of stuff like that. It was very interesting, and I learned a lot about culture, being able to provide culturally competent care, which is very important. We need to respect their wishes. Um, if we have a patient that's hospitalized, they may not like our food at all, and they may not be eating. So we need to identify, why aren't they eating? Well, maybe it's because they don't like American food. Um, some cultures think it's very, very bland and has no flavor, no taste. They like really hot things, really spicy things. So lots and lots and lots of things to consider. All right, let's talk about Gordon's framework a little bit. It's a functional health pattern assessment, and there are 11 functional areas that are considered in this framework, and it can be used on the individual, family, and communities. And here are the 11 functional health patterns: health perception, nutrition, elimination, activity, rest, sleep, cognitive, perceptual, self perception, and so on, roles, sexual, coping, and values. So, an individual's perceived health and well being affects their lifestyle and ability to function. It provides clues to improve or maintain optimal quality of health. So, the patient perceives themselves to be healthy, that's a good thing, even if they've got some issues. If they perceive themselves to not be healthy, that is not a good thing. It's hard to get them to change that perspective. The assessment, current health safety practices, previous patterns, use of the healthcare system, healthcare access. Do they have access to healthcare? Gratefully now, we are getting more and more virtual health, which is a really good thing. It is lower in cost most of the time, and it is much more readily accessible. However, it's not free. So we have a whole population of underprivileged people that are left out of the loop. They may not have access to health care. Um, Past health management is a predictor. So do they get checkups every year? I mean, this is really important. I think a lot of people don't realize that. They only go to the doctor when they're sick. Well, you should go to the doctor every year so that you can get checked out, you can get some baseline labs, you can get your blood pressure done, and that is something that is looked at over time. And then we have the 5 stages of change. I like this. In fact, I used this in my dissertation for my doctorate degree. Um, so the stages of change is pre-contemplation, contemplation, planning, action, and maintenance. Um, Change is an ever-present concept. Okay, so this is something that needs to be done constantly. So once you've done that pre-contemplation, contemplation, planning, and prep and action, maintenance is an ever-present um, concept. So you need to constantly maintain that change or you will slip back into prior patterns of behavior. So very important um, concept. Let's look at nutritional metabolic patterns. So food in relation to metabolic needs. Nutritional intake, the 24-hour recall. I really like that one. I've done this several times because often I'll have a patient who is experiencing issues with weight and they say, but I don't eat very much. The perception is that they don't eat very much, but when they sit down and they write down everything that they eat, they are eating far beyond what their means are necessary. Let's see. And metabolic demand. There are some people, some people their thyroid's off, they may gain weight a little easier, PCOS, all of those things, but it does not cause you to gain weight to the point of morbid obesity. That has nothing to do with that concept. Hypothyroidism will never be accountable for you being morbidly obese. Objective indicators are skin, mucous membranes, dentition, hair, and weight or overweight. And you want to look at all things. I had a patient several years ago that came in. She was very, very tired, didn't feel well. She wanted to be tested for mono, which is not something we test for mono, but she didn't have any other symptoms. Mono typically presents with severe one-sided sore throat with a huge tonsil and a swollen lymph node. She had none of that. She was fatigued. Okay, so I sat and I was talking to her and I started my examination. I pulled down her lower lid and it was so pale, so pale. And I said, "You appear to have anemia to me." I looked at her gums also, pale, pale, pale. "You look to have anemia to me. Have you ever been tested?" And then she said, "Oh, that's right. I had gastric bypass years ago, and as a result of it, I became severely anemic, and I had to go in and get regular iron injections, but I stopped doing it a long time ago because it was just inconvenient." Holy moly. Okay. No, no, no. You're going to the ER right now because you're about to drop on me. And she did. And she got in contact with me later thanking me because her hemoglobin was so low. I cannot remember, I can't recall the exact number, but it was so low. She was like at death's door. So she got in, they infused her, she was doing fine, and she had to get on a regular pattern of iron infusions. Elimination pattern. This includes your bowel and bladder and skin. We have their excretion of waste. So it's different. Everybody's different. Um, a lot of people think they may be constipated, but they're not. It's not necessary to have a bowel movement every day. Um, and um, the assessment when you're looking at the patient is changes in skin integrity, continence, constipation, UTI wounds, and perceptions and self treatment. As people get older, as women get older, there are going to be a lot of vaginal changes. As their body becomes depleted of estrogen, it causes changes to the sexual organs. So the moisture that was in the vaginal vault disappears, and it increases the risk of lichen sclerosis and painful intercourse and all sorts of things. Oh, increases the risk of UTI because lactobacillus, which is the probiotic that keeps your vagina healthy, is depleted in dryness. So we want to do things that can add moisture. I typically will recommend that my patients use a estrogen cream. Um, if they don't, if they an estrogen cream will work wonderfully at replenishing the moisture content of the vagina, and it also doesn't carry the risk factors for people who have had breast cancer and stuff like that. So I think over the years we've become very fearful of using any estrogens, and that is not necessary. Okay. Ooh, exercise and exercise patterns. So we want to assess what their tolerance is. What can they do? Do they value their mobility? Limitations. If do they have arthritis? Does it limit their ability to exercise? Well, then let's come up with some ideas, some exercises that the patient can do, um, because it's important to stay active. The more active you stay, the healthier you will remain. So, very important concept. And here we go again. More exercise types that they do. It's great if they can go to a gym, but if they can't, sitting in a chair, uh, resistance, uh, resistance exercise is very important, is very good. So if they want to get a small weight, or if they want to use resistance bands, those are really excellent forms of exercise for people who don't go to the gym, who are more sedentary, and don't have the capacity to um, be as active as they would like. All right, sleep rest patterns, perception of adequacy, deficits, and the assessments. We really want to evaluate whether or not there's a risk of sleep apnea in our patient. Um, Really important. If you're obese, if you snore, you've probably got sleep apnea, and your life is going to be greatly improved if we get it diagnosed and treated. People who have difficulty sleeping, I always recommend melatonin. I think melatonin works wonderfully. There are other products on the market, Unisom, NyQuil, all of those things, but that's just Benadryl. So I don't like my patients to use Benadryl all the time for sleep. I think melatonin works really well and is safe to use. Cognitive perceptual pattern, the ability to understand and follow directions, perceptual and sensory patterns, including pain, cognitive perceptual functioning, and development stage impact pattern. So again, if we're going to talk from childhood all the way to aging, there are different levels of cognition. Um, and once they reach a peak, we would like it to stay there. But we know as we age, cognition decreases a little bit in some and a lot in others. So we need to do what we can to keep that cognition at the highest level possible. One of the ways to keep that cognition high is to remain active, to remain current, reading, doing puzzles actually, keeping your mind active will help improve your cognition. All right, self perception. Um, when we are doing assessments, we're looking at a sense of personal identity, goals, emotional patterns. Developmental level is key here. Family and relationships, self-esteem, assessment, common beliefs. And when I do an annual physical on a patient, it is a long visit. It usually takes close to an hour because I go into all of this in detail. I will ask the patient these questions. Um, and in my template, in my chart, has areas for all of this stuff. So I will go and I will ask the patient about all of these things at their annual visit. We don't do it at every visit, just that annual visit. And this is a continuation of assessing cognitive perceptual pattern. Most people care about the opinions of others, therefore the support of significant others, in this case the grandmother supporting a student grandchild, will affect the child's self-perception and self-concept pattern. All right. Roles and relationships and patterns. The positions assumed by an individual. Are you the matriarch of the family, the patriarch of the family, or not? Or do you have a different level or different role in the family? Need for relationships with others is universal. And then here's some other assessments that you will do in that annual visit. Relationships affect the whole person and can exhibit in other areas like sleep, appetite, sexuality. When people are going through traumatic events, absolutely, it's going to affect their ability to eat. They're not going to sleep, or some people sleep all the time. Sexuality and reproductive pattern. The individual's sexual self-concept, self-functioning methods of intimacy, reproduction, related to self-perception, body image, individual development. And again, we talk about all of these things. I ask my patients, are you sexually active? Is it with men, women, or both? And do you identify as a woman or a male, or are you non-binary? I really, I think maybe because I've been a nurse forever, I have absolutely no issue addressing all of these things with my patients. Some younger nurses may be a little more timid, but after a while, it just becomes second nature to you. And here we go. This is essentially what I was talking about. Very important to build that trusting relationship with your patients. I like them to know that I am a partner in their healthcare. I'm not just someone that they are coming to. In fact, many of them I give my number to and tell them to call me if they have any questions. And because I want them to know that I am a partner in their healthcare. Coping and stress tolerance depicts general coping, stress. It is a necessary part of life, and believe it or not, we function a little bit better when we are under a tiny bit of stress. A tiny bit of stress is good, like when you're going to take an exam or you're going to be in an interview. A lot is not good, okay? And then coping is a learned behavior. How do we cope with this stress? And again, these are things that you learn over time, different methods to cope with the stress. And again, here we go. More about coping and stress tolerance patterns. Values, belief patterns, our spirituality, our beliefs and goals, perceptions of right and wrong, assessment objectives determine the basis of health related decisions. Interventions must be based on a value system and health beliefs. And individual values affect all of the patterns. So through promotion, health promotion through the nursing process, we want to collect that data, plan the care, implement the plan, and then evaluate the plan. I hope that this was a little bit, I hope this presentation helped you understand a little bit more about health promotion in the individual. Thank you.